Question 1. Investigation of a newly diagnosed patient's understanding and preparedness for a complex targeted therapy regimen reveals significant knowledge gaps regarding the drug's mechanism of action, potential side effects, and self-management strategies. What is the most appropriate nursing approach to address this implementation challenge? Option A. Provide a comprehensive, multimodal educational session that assesses the patient's baseline knowledge, uses clear language and visual aids, addresses potential side effects and management, and encourages active participation in questions, with a plan for ongoing reinforcement. Option B. Rely on the patient's oncologist to provide all necessary education, as the nurse's role is primarily administrative. Option C. Deliver a brief, one-time overview of the drug's name and dosage, assuming the patient will consult online resources for further information. Option D. Focus exclusively on the molecular targets of the therapy, without detailing practical implications for the patient's daily life or symptom management. Correct answer is A. Provide a comprehensive, multimodal educational session that assesses the patient's baseline knowledge, uses clear language and visual aids, addresses potential side effects and management, and encourages active participation in questions, with a plan for ongoing reinforcement. Explanation. This scenario presents a common implementation challenge in oncology nursing, ensuring patient understanding and adherence to complex targeted therapy regimens. The challenge lies in bridging the gap between the scientific mechanism of action of targeted agents and the patient's lived experience and ability to manage treatment at home. Accurate patient education is paramount for optimizing therapeutic outcomes, minimizing adverse events, and upholding patient autonomy, all of which are core tenets of professional nursing practice and are implicitly supported by the OCN certification's focus on evidence-based, patient-centered care. The correct approach prioritizes a comprehensive, individualized, and ongoing educational process. This involves assessing the patient's baseline knowledge, learning style, and potential barriers to understanding. It emphasizes clear, jargon-free language, visual aids, and opportunities for questions. Furthermore, it acknowledges the importance of involving the patient's support system and establishing clear communication channels for reporting side effects. This aligns with the ethical principles of beneficence, acting in the patient's best interest, and autonomy, respecting the patient's right to make informed decisions, as well as the professional responsibility to provide high-quality patient education, a cornerstone of OCN practice. An incorrect approach that relies solely on a brief, one-time explanation fails to account for the complexity of targeted therapies and the cognitive load on a newly diagnosed patient. This approach neglects the principles of adult learning and can lead to significant knowledge deficits, impacting adherence and safety. Ethically, it breaches the duty to inform and can undermine patient autonomy by not providing sufficient information for truly informed consent. Another incorrect approach that focuses only on the drug's mechanism without practical application or side effect management overlooks critical aspects of safe and effective treatment. This can result in patients being unprepared for common toxicities, leading to unnecessary distress, non-adherence, or delayed reporting of serious adverse events, which is a failure in patient advocacy and safety. A third incorrect approach that assumes the patient will seek out information independently abdicates the nurse's primary responsibility for patient education and support, potentially leaving vulnerable patients without essential guidance and increasing the risk of adverse outcomes. This is a dereliction of professional duty and a failure to provide comprehensive care. The professional decision-making process in such situations should involve a systematic approach. First, assess the patient's current knowledge and learning needs. Second, develop an individualized education plan that considers the patient's specific treatment, potential side effects, and lifestyle. Third, deliver education using clear, understandable language and appropriate methods. Fourth, evaluate the patient's comprehension and provide opportunities for clarification. And fifth, establish ongoing support and follow-up to reinforce learning and address emerging concerns. Question 2. What factors determine the ethical obligation of an oncology certified nurse regarding the disclosure of a patient's genetic predisposition to cancer to their at-risk family members when the patient has not explicitly consented to such disclosure? Option A. The patient's right to privacy and autonomy, balanced with the potential for familial benefit and the nurse's duty to educate and advocate. Option B. The patient's perceived willingness to discuss the findings with their family without requiring explicit consent for disclosure. Option C. The immediate need to inform family members to facilitate early cancer screening and prevention, overriding patient confidentiality. Option D. The nurse's professional judgment regarding the severity of the genetic risk and the likelihood of family members developing cancer. The correct answer is A. The patient's right to privacy and autonomy, balanced with the potential for familial benefit and the nurse's duty to educate and advocate. Explanation. Scenario analysis. This scenario is professionally challenging because it involves navigating complex ethical considerations surrounding genetic information in cancer care. The oncology nurse must balance the patient's right to privacy and autonomy with the potential benefits of sharing information that could impact family members' health. The nurse's role extends beyond direct patient care to encompass education, advocacy, and ethical decision-making, especially when dealing with sensitive genetic predispositions. Correct approach analysis. The correct approach prioritizes patient autonomy and informed consent. It recognizes that the patient has the ultimate right to decide whether or not to disclose genetic information to their family. This aligns with core ethical principles in healthcare, including respect for persons and beneficence, by ensuring the patient's wishes are honored while also exploring avenues for voluntary disclosure and support. The nurse's role is to educate the patient about the implications of their genetic findings for their family and to facilitate their decision-making process, offering resources and support for communication if the patient chooses to share. This approach upholds the nurse's professional responsibility to act as a patient advocate and to maintain confidentiality as per OCN guidelines and relevant U.S. healthcare regulations. Incorrect approaches analysis. One incorrect approach involves directly informing the patient's family without the patient's explicit consent. This is a significant breach of patient confidentiality and violates the Health Insurance Portability and Accountability Act, HIPAA, in the U.S. It undermines the trust between the nurse and the patient and disregards the patient's autonomy over their personal health information. Another incorrect approach is to dismiss the genetic findings as irrelevant to the family, thereby failing to provide the patient with complete and accurate information about potential implications. This neglects the nurse's duty to educate and advocate for the patient and their family, potentially leading to missed opportunities for early detection or preventative measures in at-risk relatives. It also fails to acknowledge the interconnectedness of genetic predispositions within families. A third incorrect approach is to pressure the patient into disclosing the information to their family, overriding their personal decision-making. This infringes upon the patient's right to autonomy and can create undue stress and conflict. The nurse's role is to support, not coerce, the patient's choices regarding sensitive health information. Professional reasoning. Professionals should approach such dilemmas by first ensuring they have a thorough understanding of the patient's genetic findings and their implications. They should then engage in open and honest communication with the patient, explaining the potential benefits and risks of disclosure to family members. Nurse should empower the patient to make an informed decision, offering resources such as genetic counseling and support for family communication. If the patient consents to disclosure, the nurse can assist in facilitating that process. If the patient declines, the nurse must respect that decision while continuing to provide comprehensive care to the patient. This process emphasizes patient-centered care, ethical integrity, and adherence to professional standards and regulations. Question 3. When evaluating a patient receiving their first dose of a new chemotherapy agent who develops sudden onset of pruritus, mild urticaria, and mild shortness of breath, which of the following actions is the most appropriate initial nursing intervention according to standard oncology protocols? Option A. Immediately discontinue the chemotherapy infusion and notify the oncologist. Option B. Increase the rate of the chemotherapy infusion to see if symptoms resolve. Option C. Document the symptoms and wait for the patient to report further changes. Option D. Administer an oral antihistamine and continue monitoring the infusion. The correct answer is A. Immediately discontinue the chemotherapy infusion and notify the oncologist. Explanation. This scenario presents a common challenge in oncology nursing, managing a patient's adverse reaction to chemotherapy while adhering to established protocols and ensuring patient safety. The professional challenge lies in accurately identifying the cause of the patient's symptoms, differentiating between expected side effects and a more serious hypersensitivity reaction, and initiating the appropriate intervention promptly. This requires a deep understanding of chemotherapy agents, their potential toxicities, and the specific institutional policies governing their administration and management of adverse events. The correct approach represents best professional practice because it prioritizes patient safety and adheres to established protocols for managing potential chemotherapy-induced hypersensitivity reactions, promptly assessing vital signs, discontinuing the infusion as per protocol, and notifying the oncologist are critical steps in preventing a life-threatening anaphylactic response. This aligns with the OCN's responsibility to monitor patients for adverse reactions and to intervene appropriately and in a timely manner, as mandated by nursing practice standards and institutional policies, which are often informed by regulatory guidelines for safe medication administration. An incorrect approach that involves continuing the infusion while observing the patient is a significant regulatory and ethical failure. This disregards the potential for rapid deterioration and anaphylaxis, violating the fundamental principle of do no harm. It also fails to adhere to protocols designed to mitigate severe adverse drug reactions, potentially leading to serious patient harm and contravening nursing practice acts that require nurses to act within their scope of practice and follow established safety procedures. Another incorrect approach, such as administering an antihistamine without discontinuing the infusion or notifying the physician, is also professionally unacceptable. While antihistamines may be part of the management of hypersensitivity, administering them while the offending agent is still infusing can mask symptoms without addressing the root cause, delaying definitive treatment and potentially exacerbating the reaction. This demonstrates a failure to follow a comprehensive management plan and a lack of critical assessment of the situation. Finally, an incorrect approach that involves waiting for the patient's symptoms to worsen significantly before taking action is a grave error. This demonstrates a lack of proactive monitoring and a failure to recognize the urgency of hypersensitivity reactions. It violates the ethical obligation to provide timely and effective care and contravenes regulatory expectations for vigilant patient monitoring and prompt intervention in critical situations. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize and assess the patient's symptoms, comparing them against known side effects and potential adverse reactions of the administered chemotherapy. 2. Immediately consult institutional protocols for managing suspected hypersensitivity reactions. 3. Prioritize patient safety by discontinuing the infusion if indicated by protocol or clinical judgment. 4. Promptly notify the prescribing oncologist or designated medical provider. 5. Initiate supportive care as per protocol and physician orders. 6. Document all assessments, interventions, and communications thoroughly. Question 4. Operational review demonstrates that a patient diagnosed with breast cancer has undergone a biopsy confirming invasive ductal carcinoma. The oncology certified nurse is tasked with ensuring the patient's treatment plan is aligned with the most current diagnostic and staging information. Which of the following actions best reflects the nurse's responsibility in this scenario? Adhering to U.S. regulatory frameworks and OCN exam guidelines for breast cancer staging and treatment. Option A. Rely solely on the pathology report's tumor grade to initiate treatment discussions, without further investigation into tumor size, lymph node involvement, or distant metastases. Option B. Review all available pathology reports, imaging studies, mammogram, ultrasound, MRI, and clinical assessment findings to determine the T, N, and M components of the cancer stage according to the latest AJC guidelines, and then collaborate with the physician to confirm the overall stage and discuss treatment implications. Option C. Proceed with planning patient education on standard adjuvant chemotherapy regimens, assuming the cancer is at an early stage based on the positive biopsy result. Option D. Delegate the entire responsibility of staging interpretation and treatment planning to the medical oncologist without actively reviewing the patient's diagnostic data. The correct answer is B. Review all available pathology reports, imaging studies, mammogram, ultrasound, MRI, and clinical assessment findings to determine the T, N, and M components of the cancer stage according to the latest AJC guidelines, and then collaborate with the physician to confirm the overall stage and discuss treatment implications. Explanation. This scenario presents a professional challenge due to the critical need for accurate staging of breast cancer, which directly dictates treatment pathways and patient prognosis. The nurse must synthesize complex clinical information, diagnostic findings, and establish staging criteria to ensure appropriate care planning. Misinterpretation of staging can lead to suboptimal treatment, impacting patient outcomes and potentially violating standards of care. The correct approach represents best professional practice because it aligns with the core principles of evidence-based nursing and patient advocacy. By meticulously reviewing all available data against the established staging system, e.g., OCN staging for breast cancer, which is the standard in U.S. regulatory frameworks for oncology certification, the nurse ensures that the patient receives the most appropriate and individualized treatment plan. This adherence to established guidelines is a cornerstone of professional accountability and patient safety, reflecting the regulatory expectation for nurses to practice within their scope and utilize current best practices. An incorrect approach that relies solely on a single diagnostic test without considering the full clinical picture is professionally unacceptable. This failure represents a breach of professional responsibility by not performing a comprehensive assessment. Ethically, it could be seen as a deviation from the duty of care, potentially leading to patient harm through inadequate treatment. From a regulatory standpoint, it demonstrates a lack of adherence to established protocols for cancer staging and management, which are implicitly or explicitly required by nursing practice acts and professional standards. Another incorrect approach that involves making assumptions about treatment based on a preliminary diagnosis without confirmed staging is also professionally unacceptable. This bypasses the essential step of accurate staging, which is foundational to treatment decisions. It risks initiating inappropriate therapies, wasting resources, and potentially exposing the patient to unnecessary toxicity or delaying effective treatment. This constitutes a failure to uphold the principle of beneficence and non-maleficence, as well as a potential violation of regulatory requirements for evidence-based practice. Third incorrect approach that involves deferring the entire staging interpretation to another discipline without active nursing engagement is professionally deficient. While collaboration is vital, the oncology nurse has a specific role in understanding and applying staging information to patient care. Abdicating this responsibility entirely can lead to gaps in communication and a less holistic understanding of the patient's condition, potentially impacting the nursing care plan. This can be viewed as a failure to fully utilize professional expertise and contribute to the interdisciplinary team's comprehensive assessment. The professional reasoning process for similar situations should involve a systematic approach. 1. Thoroughly review all patient data, including pathology reports, imaging studies, and clinical examination findings. 2. Consult the relevant current staging guidelines, e.g., OCN for breast cancer in the U.S. context. 3. Synthesize the data to accurately assign the stage. 4. Collaborate with the interdisciplinary team, physicians, radiologists, pathologists, to confirm staging and discuss treatment implications. 5. Document the staging and rationale clearly. 6. Educate the patient about their diagnosis and treatment plan based on the confirmed staging. Question 5. Stakeholder feedback indicates a need to enhance the assessment of patients newly diagnosed with colorectal cancer to ensure optimal treatment planning. A 68-year-old patient presents with a recent diagnosis of colorectal cancer. The nurse is preparing to discuss potential treatment pathways. Which of the following approaches best facilitates a risk-informed and patient-centered treatment discussion? Option A. Immediately present a detailed overview of all available advanced surgical and systemic therapies for colorectal cancer, assuming the patient will grasp the complexities. Option B. Conduct a comprehensive risk assessment that integrates the specific histological type and TNM stage of the patient's colorectal cancer with their individual clinical presentation and understanding of the disease to tailor educational content and treatment options. Option C. Provide a generic brochure on colorectal cancer treatment options and schedule a follow-up appointment without first assessing the patient's current knowledge or concerns. Option D. Focus the discussion exclusively on the most common subtype of colorectal cancer and its standard treatment, without further investigation into the patient's specific pathology or risk factors. The correct answer is B. Conduct a comprehensive risk assessment that integrates the specific histological type and TNM stage of the patient's colorectal cancer with their individual clinical presentation and understanding of the disease to tailor educational content and treatment options. Explanation. This scenario is professionally challenging because it requires the oncology certified nurse to synthesize complex information about colorectal cancer, including its varied types and staging, to inform a patient's treatment plan. The nurse must not only understand the disease, but also apply this knowledge within the strict regulatory framework governing patient care and informed consent. The challenge lies in accurately assessing the patient's risk factors and understanding of their disease to tailor educational interventions and treatment discussions, ensuring the patient can make truly informed decisions. A correct approach represents best professional practice because it prioritizes a comprehensive risk assessment that considers the patient's individual clinical presentation, the specific characteristics of their colorectal cancer, type and stage, and their personal understanding and values. This aligns with the ethical principles of beneficence and autonomy, ensuring that treatment recommendations are evidence-based and tailored to the patient's unique situation. Furthermore, it adheres to regulatory guidelines that mandate patient education and shared decision-making in cancer treatment, ensuring that the patient is an active participant in their care. An incorrect approach that focuses solely on the most common type of colorectal cancer without considering the patient's specific pathology fails to uphold the principle of individualized care and may lead to suboptimal treatment recommendations. This could be a regulatory failure if it deviates from standards of care that require personalized treatment planning based on accurate diagnosis and staging. Another incorrect approach that bypasses a thorough risk assessment and proceeds directly to discussing advanced treatment options without gauging the patient's comprehension or readiness is ethically problematic. It violates the principle of informed consent by assuming understanding and potentially overwhelming the patient, which could be a violation of patient rights and regulatory requirements for clear communication. An approach that relies on generalized treatment protocols without a specific patient risk assessment overlooks the nuances of different colorectal cancer subtypes and stages, potentially leading to inappropriate or ineffective interventions, and thus failing to meet professional standards of care. Professionals should employ a systematic decision-making process that begins with a thorough patient assessment, including a detailed history, physical examination, and review of diagnostic findings. This is followed by an evaluation of the patient's understanding of their diagnosis and treatment options, incorporating their values and preferences. Treatment planning should then be a collaborative process between the patient and the healthcare team, guided by evidence-based practice and regulatory requirements for informed consent and patient advocacy. Question 6. The assessment process reveals a patient with newly diagnosed multiple myeloma presenting with severe bone pain and laboratory findings indicative of hypercalcemia. Which of the following nursing actions best addresses the immediate risks associated with this presentation? Option A. Administer prescribed analgesics for bone pain and initiate intravenous hydration as ordered. Option B. Encourage increased oral fluid intake and ambulation to manage hypercalcemia. Option C. Educate the patient on the long-term prognosis of multiple myeloma. Option D. Document the patient's pain level and hypercalcemia findings for the physician's review. The correct answer is A. Administer prescribed analgesics for bone pain and initiate intravenous hydration as ordered. Explanation. The assessment process reveals a patient with newly diagnosed multiple myeloma, presenting with significant bone pain and hypercalcemia. This scenario is professionally challenging due to the complexity of managing a hematologic malignancy with systemic implications, requiring a nuanced approach to risk assessment that balances immediate symptom management with long-term treatment planning and patient education. The nurse must integrate knowledge of the disease process, potential complications, and available interventions while adhering to OCN scope of practice and ethical guidelines. The correct approach involves a comprehensive risk assessment that prioritizes patient safety and symptom control. This includes evaluating the severity of bone pain, assessing for signs of hypercalcemia crisis, e.g., altered mental status, dehydration, cardiac arrhythmias, and identifying potential risks for pathological fractures. This approach aligns with OCN standards of practice, which emphasize patient-centered care, evidence-based interventions, and proactive management of complications. It also reflects ethical obligations to promote patient well-being and prevent harm. An incorrect approach would be to solely focus on pain management without addressing the underlying hypercalcemia and fracture risk. This fails to recognize the systemic nature of multiple myeloma and its potential for life-threatening complications. Ethically, this constitutes a failure to provide comprehensive care and a potential breach of the duty to prevent harm. Another incorrect approach would be to initiate aggressive treatment protocols without a thorough assessment of the patient's current status and tolerance, potentially leading to adverse events or undertreatment of critical symptoms. This disregards the principle of individualized care and may violate regulatory guidelines regarding safe medication administration and treatment initiation. A third incorrect approach would be to defer all risk assessment and management decisions to the physician, neglecting the advanced practice role of the oncology nurse in patient monitoring, early detection of complications, and patient education. This abdication of responsibility is professionally unacceptable and falls short of the OCN's expected level of engagement in patient care. Professional decision-making in such situations requires a systematic process. 1. Recognize the patient's presenting symptoms and diagnosis. 2. Conduct a thorough head-to-toe assessment, focusing on potential complications related to the specific hematologic malignancy. 3. Prioritize immediate life-threatening risks, e.g., hypercalcemia crisis, spinal cord compression. 4. Collaborate with the interdisciplinary team to develop a comprehensive care plan. 5. Educate the patient and family about the disease, treatment, and potential complications. 6. Continuously monitor the patient's response to interventions and adjust the plan as needed. Question 7. Process analysis reveals that a patient presents with a palpable firm mass. While both sarcomas and adenocarcinomas can manifest as solid tumors, their origins and typical clinical behaviors differ significantly. Which characteristic is most critical for an oncology-certified nurse to consider when differentiating between these two broad categories of solid tumors to inform subsequent care planning? Option A. The general consistency of the mass as firm. Option B. The patient's subjective experience of pain with palpation. Option C. The presence of a palpable mass regardless of location. Option D. The specific tissue of origin and cellular morphology. The correct answer is D. The specific tissue of origin and cellular morphology. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the oncology-certified nurse to differentiate between two distinct types of solid tumors that share some superficial similarities but have fundamentally different underlying biology, treatment implications, and prognoses. Misidentification can lead to inappropriate treatment planning, delayed or ineffective interventions, and potentially adverse patient outcomes. The nurse must rely on a deep understanding of cancer characteristics beyond just gross appearance. Correct approach analysis. The correct approach involves recognizing that, while both are solid tumors, the specific cellular origin and growth patterns are key differentiators. Identifying the tumor as originating from glandular tissue adenocarcinoma points towards a specific set of diagnostic markers, imaging characteristics, and treatment modalities, e.g., hormone therapy, targeted therapies, that are distinct from a tumor arising from mesenchymal tissue sarcoma. This precise classification is crucial for accurate staging, treatment selection, and predicting patient response, aligning with the OCN's responsibility to provide evidence-based, individualized care as guided by professional nursing standards and oncology best practices. Incorrect approaches analysis. One incorrect approach would be to focus solely on the macroscopic appearance of a solid mass. While a solid mass is a characteristic, it is not specific enough to differentiate between various cancer types. This approach lacks the necessary depth of understanding of cellular pathology and ignores critical diagnostic information, potentially leading to misdiagnosis and inappropriate care, which violates the ethical principle of non-maleficence and the professional standard of competent practice. Another incorrect approach would be to assume the treatment will be similar for all solid tumors. This is a dangerous oversimplification. Different cancer types respond to vastly different therapeutic regimens. For example, a sarcoma might be treated with surgery and radiation, while an adenocarcinoma might involve chemotherapy, targeted therapy, or immunotherapy, depending on the specific subtype and molecular markers. This assumption demonstrates a failure to apply specialized oncology knowledge and could result in the administration of ineffective or harmful treatments, a breach of professional accountability. A third incorrect approach would be to rely on patient-reported symptoms alone for definitive classification. While symptoms are important for initial assessment and suspicion, they are rarely pathognomonic for a specific cancer type. Many symptoms overlap across different malignancies. This approach bypasses essential diagnostic procedures and pathological confirmation, undermining the diagnostic process and potentially delaying critical interventions, which is a failure in professional judgment and adherence to diagnostic protocols. Professional reasoning. Oncology certified nurses must employ a systematic approach to cancer type identification. This involves integrating information from patient history, physical examination, diagnostic imaging, laboratory tests, including tumor markers, and most importantly, histopathological examination. The nurse's role is to synthesize this data, understand the implications of different cancer characteristics, histology, grade, stage, molecular profile, and communicate effectively with the interdisciplinary team to ensure the most accurate diagnosis and appropriate evidence-based treatment plan. This process is guided by the OCN certification's emphasis on advanced knowledge and skills in oncology nursing practice, prioritizing patient safety and optimal outcomes. Question 8. Market research demonstrates a growing need for oncology nurses to articulate the fundamental cellular mechanisms driving cancer development to patients and interdisciplinary teams. Considering the cell cycle's role, which of the following best explains how disruptions in its normal progression contribute to the initiation and progression of malignant neoplasms? Option A. Dysregulation of cell cycle checkpoints leads to uncontrolled cell division, bypassing normal apoptotic pathways and accumulating genetic mutations, all of which are hallmarks of cancer. Option B. The cell cycle's primary function in cancer is to facilitate rapid tumor growth by increasing nutrient uptake, with minimal impact on cell division or death. Option C. Cancer arises solely from the failure of cells to enter the cell cycle, leading to a lack of cellular turnover and subsequent tumor formation. Option D. Cancer development is primarily caused by external environmental toxins that directly damage cellular DNA, overriding any normal cell cycle controls. The correct answer is A. Dysregulation of cell cycle checkpoints leads to uncontrolled cell division, bypassing normal apoptotic pathways and accumulating genetic mutations, all of which are hallmarks of cancer. Explanation. This scenario presents a professional challenge due to the inherent complexity of cell cycle regulation and its disruption in cancer development, requiring a nuanced understanding beyond basic memorization. The nurse must apply theoretical knowledge to a practical clinical context, ensuring patient care aligns with established OCN competencies and ethical standards. The correct approach represents best professional practice because it directly addresses the underlying cellular mechanisms of cancer development, which is a core competency for an oncology certified nurse. Understanding how uncontrolled cell proliferation, evasion of apoptosis, and genetic instability, all stemming from dysregulated cell cycle checkpoints, contribute to tumor growth and metastases is fundamental to providing evidence-based, patient-centered care. This knowledge informs treatment decisions, patient education, and symptom management, aligning with the OCN certification's focus on advanced oncology nursing practice and the ethical imperative to provide competent, up-to-date care. An incorrect approach that focuses solely on superficial symptoms without understanding the cellular basis of cancer development fails to meet the advanced practice expectations of an OCN. This would be a regulatory and ethical failure, as it demonstrates a lack of the in-depth knowledge required for effective oncology nursing, potentially leading to suboptimal patient outcomes. Similarly, an approach that misattributes cancer development to external factors without acknowledging the internal cellular dysregulation, such as errors in DNA repair or uncontrolled cell division, is a significant knowledge gap. This would be ethically problematic as it could lead to misinformed patient education and a failure to address the root causes of the disease at a cellular level. An approach that oversimplifies the process by focusing only on one aspect of cell cycle disruption, such as only proliferation, without considering other critical factors like apoptosis evasion or angiogenesis, would also be a failure. This lack of comprehensive understanding limits the nurse's ability to anticipate and manage the multifaceted nature of cancer. The professional decision-making process for similar situations should involve a systematic approach. First, identify the core scientific principles underlying the patient's condition, in this case, cell cycle dysregulation in cancer. Second, connect these principles to the clinical manifestations and therapeutic interventions. Third, Consult current evidence-based guidelines and research to ensure the highest standard of care. Finally, prioritize patient education and advocacy based on a thorough understanding of the disease process at the cellular level. Question 9. Cost-benefit analysis shows that while some fatigue management strategies require significant patient effort or time investment, the long-term improvement in quality of life and functional capacity often outweighs these initial costs. Considering this, which of the following approaches best reflects a cost-effective and patient-centered strategy for managing cancer-related fatigue? Option A. Providing the patient with a generic brochure on fatigue management and advising them to try whatever seems most appealing without further assessment or follow-up. Option B. Prescribing stimulant medications to combat fatigue with minimal discussion of lifestyle modifications, assuming a quick pharmacological fix is the most efficient solution. Option C. Educating the patient that fatigue is an unavoidable consequence of cancer treatment and encouraging them to simply rest whenever they feel tired, without exploring active management strategies. Option D. Implementing a personalized fatigue management plan developed collaboratively with the patient, incorporating education on energy conservation techniques, graded exercise, sleep hygiene, and addressing psychosocial factors, with regular follow-up to assess effectiveness and adjust interventions. Correct answer is D. Implementing a personalized fatigue management plan developed collaboratively with the patient, incorporating education on energy conservation techniques, graded exercise, sleep hygiene, and addressing psychosocial factors, with regular follow-up to assess effectiveness and adjust interventions. Explanation: this scenario is professionally challenging because managing cancer-related fatigue requires a nuanced, individualized approach that balances patient preferences, evidence-based interventions, and resource availability. The OCN must critically evaluate various strategies, considering their potential benefits against their costs, not just financial, but also time, effort, and potential side effects, for the patient and the healthcare system. The OCN's role is to empower the patient with knowledge and support, facilitating informed decision-making. Correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment and a collaborative development of a personalized fatigue management plan. This aligns with OCN certification standards that emphasize holistic care, patient education, and the application of evidence-based practice. It respects the patient's autonomy and acknowledges that fatigue is a complex, multidimensional symptom with varying causes and impacts. This approach is ethically sound, promoting beneficence acting in the patient's best interest and non-maleficence, avoiding harm by not imposing ineffective or burdensome interventions. An incorrect approach that focuses solely on pharmacological interventions fails to acknowledge the multifactorial nature of fatigue and may lead to unnecessary medication use, potential side effects, and neglect of non-pharmacological strategies that are often more effective and sustainable. This could be considered a failure in applying evidence-based practice and could lead to patient harm, non-maleficence. Another incorrect approach that relies on a one-size-fits-all educational pamphlet without assessing the patient's specific needs or preferences overlooks the individualized nature of care and patient autonomy. This can lead to ineffective interventions and patient dissatisfaction, potentially violating principles of patient-centered care. A third incorrect approach that dismisses the patient's concerns about fatigue as a normal part of cancer treatment fails to validate the patient's experience and can lead to a lack of appropriate support and management, potentially causing significant distress and impacting quality of life. This is a failure in compassionate care and can undermine the therapeutic relationship. The professional decision-making process for similar situations should involve a systematic assessment of the patient's fatigue onset, duration, intensity, impact on daily life, contributing factors, a review of evidence-based fatigue management strategies, pharmacological and non-pharmacological, a collaborative discussion with the patient about their goals and preferences, and the development of a tailored, iterative plan with ongoing evaluation and adjustment. Question 10. The assessment process reveals that a patient with advanced lung cancer exhibits a TME characterized by significant immunosuppression, high levels of angiogenesis, and a dense stromal component. Considering these findings, which of the following nursing considerations is most critical for optimizing the patient's treatment plan and supportive care? Option A. Prioritizing interventions to mitigate potential cardiotoxicity from systemic chemotherapy, as this is a common side effect. Option B. focusing on strategies to enhance immune surveillance and overcome immunosuppression within the TME, potentially in conjunction with targeted therapies. Option C, emphasizing aggressive management of pain and nausea, as these are expected symptoms of advanced malignancy. Option D, recommending a reduction in the dosage of all systemic agents to minimize the risk of general toxicity. Correct answer is A, prioritizing interventions to mitigate potential cardiotoxicity from systemic chemotherapy, as this is a common side effect. Explanation: the assessment process reveals a complex interplay of factors within the tumor microenvironment, TME, that can significantly impact treatment efficacy and patient outcomes. This scenario is professionally challenging because it requires the oncology certified nurse OCN to synthesize information from various sources, understand the dynamic nature of the TME, and apply this knowledge to individualized patient care within the strict regulatory framework governing nursing practice in the United States. The OCN must consider not only the direct effects of cancer therapies, but also the indirect influences of immune cells, stromal components, and extracellular matrix on treatment response and potential toxicities. The correct approach represents best professional practice because it prioritizes a comprehensive, evidence-based assessment of the TME's impact on the patient's specific cancer and treatment plan. This aligns with the American Nurses Association ANA standards of practice, particularly those related to assessment, diagnosis, and implementation, which mandate thorough data collection and analysis to inform nursing interventions. By considering the multifaceted nature of the TME, the OCN can anticipate potential challenges, optimize supportive care, and collaborate effectively with the interdisciplinary team to tailor treatment strategies. This approach is ethically sound, upholding the principle of beneficence by striving for the best possible patient outcomes and non-maleficence by minimizing potential harm. Incorrect approaches fail to meet professional standards due to several regulatory and ethical shortcomings. One incorrect approach might focus solely on the direct cytotoxic effects of chemotherapy, neglecting the crucial role of the TME in mediating resistance or enhancing toxicity. This represents a failure to conduct a comprehensive assessment as required by nursing practice standards and could lead to suboptimal patient management. Another incorrect approach might overlook the influence of immune checkpoints or inflammatory mediators within the TME, which are critical for understanding the efficacy of immunotherapies. This oversight would violate the principle of providing evidence-based care and could result in the administration of ineffective treatments. A third incorrect approach might prioritize a single component of the TME without considering its interaction with other elements, leading to an incomplete understanding of the overall impact. This demonstrates a lack of critical thinking and a failure to integrate complex biological information, which is essential for advanced nursing practice. Professional decision-making in similar situations requires a systematic approach. OCN should begin by gathering all available patient-specific data, including diagnostic reports, imaging studies, and previous treatment histories. Next, they should consult current evidence-based literature and guidelines relevant to the patient's specific cancer type and stage, paying close attention to research on the TME and its implications for treatment. The OCN should then critically analyze how these TME factors might influence the planned therapy, considering potential benefits, risks, and the need for specialized supportive care. Finally, the OCN must communicate their findings and recommendations clearly to the interdisciplinary team, advocating for the patient's best interests and ensuring that the nursing care plan is aligned with the overall treatment strategy. Question 11. The efficiency study reveals that the oncology unit is experiencing a higher than average patient readmission rate within 30 days of discharge, particularly for patients with complex palliative care needs. Which of the following actions would best address this issue within the scope of oncology nursing practice and regulatory guidelines? Option A. Conduct individual performance reviews for nurses on the unit, focusing on their role in patient discharges and readmissions. Option B. Convene a multidisciplinary team, including physicians, nurses, social workers, and palliative care specialists, to review discharge planning processes for palliative care patients and identify areas for improvement. Option C. Mandate that all oncology patients receive a home health visit within 48 hours of discharge to ensure continuity of care. Option D. Increase the number of registered nurses assigned to the oncology unit to reduce the nurse-to-patient ratio, assuming this will improve discharge preparedness. The correct answer is B. Convene a multidisciplinary team, including physicians, nurses, social workers, and palliative care specialists, to review discharge planning processes for palliative care patients and identify areas for improvement. Explanation: the efficiency study reveals that the oncology unit is experiencing a higher than average patient readmission rate within 30 days of discharge, particularly for patients with complex palliative care needs. This scenario is professionally challenging because it directly impacts patient outcomes, resource utilization, and the reputation of the nursing unit. It requires a nuanced understanding of oncology nursing principles beyond basic disease management, encompassing holistic patient care, effective communication, and coordination of services. The correct approach, which involves a multidisciplinary team review of discharge planning processes for palliative care patients, represents best professional practice. This aligns with the core tenets of oncology nursing, emphasizing patient-centered care, continuity of care, and the prevention of adverse events. Regulatory frameworks and professional guidelines for oncology nursing, such as those promoted by the Oncology Nursing Society, ONS, advocate for interdisciplinary collaboration to optimize patient outcomes and reduce readmissions. This approach directly addresses the identified inefficiency by seeking to understand and mitigate the root causes of readmissions, which often stem from inadequate symptom management, poor patient/family education, or insufficient post-discharge support. An incorrect approach that focuses solely on increasing nurse-to-patient ratios without investigating the specific reasons for readmissions fails to address the underlying issues. While adequate staffing is crucial, it is not a panacea for complex care coordination problems. This approach could be seen as a superficial fix that doesn't engage with the systemic factors contributing to readmissions, potentially leading to continued inefficiencies and suboptimal patient care. Ethically, it neglects the professional responsibility to identify and rectify care delivery problems that negatively affect patients. Another incorrect approach that involves implementing a blanket protocol for all oncology patients to receive home health visits post-discharge, regardless of their individual needs, is also professionally unsound. This lacks the individualized assessment and care planning essential in oncology nursing. It represents a waste of resources and may not adequately address the specific needs of patients who do not require such intensive follow-up, while potentially still failing to provide sufficient support for those who do. This approach deviates from the principle of providing evidence-based, patient-specific care. A further incorrect approach that involves blaming individual nurses for the readmission rates without a systemic review is ethically and professionally unacceptable. This fosters a punitive environment and ignores the complex interplay of factors that contribute to patient outcomes. Professional oncology nursing practice demands a culture of continuous quality improvement, where challenges are addressed through collaborative problem-solving and system-level analysis, not through individual scapegoating. Professional decision-making process for similar situations should involve a systematic approach. 1. Identify the problem. Clearly define the issue using objective data like the efficiency study's findings. 2. Gather information. Collect data from various sources, including patient records, staff feedback, and patient/family experiences. 3. Analyze the root causes. Employ tools like root cause analysis to understand why the problem is occurring. 4. Develop solutions. Brainstorm and evaluate potential interventions, considering their feasibility, effectiveness, and alignment with professional standards and ethical principles. 5. Implement and evaluate. Put the chosen solution into practice and continuously monitor its impact, making adjustments as needed. 6. Foster a culture of learning. Encourage open communication and a commitment to ongoing quality improvement. Question 12. Process analysis reveals that understanding the distinct roles of genetic alterations in cancer development is paramount for effective targeted therapy selection. When considering a patient's tumor molecular profile, how should an oncology-certified nurse differentiate between the implications of an activated oncogene versus an inactivated tumor suppressor gene in the context of treatment planning? Option A. Conflate the functions, assuming that both oncogenes and tumor suppressor genes are always activated in cancer cells, necessitating broad-spectrum cytotoxic chemotherapy. Option B. Prioritize identifying the specific gene mutation without considering whether it activates an oncogene or inactivates a tumor suppressor gene, as the presence of any mutation warrants similar treatment approaches. Option C. Recognize that activated oncogenes drive uncontrolled cell proliferation, making them targets for therapies designed to inhibit their signaling pathways, while inactivated tumor suppressor genes normally restrain cell growth, and their loss contributes to cancer development, often requiring different therapeutic strategies. Option D. Understand that both activated oncogenes and inactivated tumor suppressor genes lead to increased DNA damage, and therefore, treatments should focus on general DNA repair mechanisms. The correct answer is C. Recognize that activated oncogenes drive uncontrolled cell proliferation, making them targets for therapies designed to inhibit their signaling pathways, while inactivated tumor suppressor genes normally restrain cell growth, and their loss contributes to cancer development, often requiring different therapeutic strategies. Explanation: scenario analysis. This scenario presents a challenge for an oncology certified nurse, OCN, in understanding the fundamental biological mechanisms driving cancer progression and treatment response. Differentiating between the roles of oncogenes and tumor suppressor genes in the context of targeted therapy selection requires a nuanced understanding of molecular biology, which directly impacts patient care decisions and the effectiveness of interventions. The OCN must apply this knowledge to interpret diagnostic information and communicate effectively with the interdisciplinary team and the patient. Correct approach analysis. The correct approach involves recognizing that oncogenes are mutated genes that promote cell growth and proliferation, often becoming constitutively active, while tumor suppressor genes normally inhibit cell growth and are inactivated or mutated in cancer. Understanding this distinction is crucial for selecting targeted therapies. For instance, therapies targeting activated oncogenes, like EGFR inhibitors for certain lung cancers, aim to block the aberrant signaling pathway driving tumor growth. Conversely, therapies that restore or mimic the function of tumor suppressor genes are less common, but represent a conceptual understanding of how these genes contribute to cancer. This knowledge aligns with the OCN's role in evidence-based practice and patient education, ensuring that treatment decisions are grounded in the underlying biology of the patient's specific cancer. Incorrect approaches analysis. An approach that focuses solely on the general concept of DNA damage without differentiating the specific roles of oncogenes and tumor suppressor genes fails to provide the precision needed for targeted therapy selection. This is a superficial understanding that does not inform clinical decision-making regarding specific molecular targets. An approach that conflates the functions of oncogenes and tumor suppressor genes, perhaps by suggesting that both are always activated in cancer, demonstrates a fundamental misunderstanding of cancer biology. This error would lead to incorrect assumptions about treatment strategies and could result in the selection of inappropriate or ineffective therapies. An approach that prioritizes the identification of specific mutations without understanding the functional consequence of those mutations, i.e., whether they activate an oncogene or inactivate a tumor suppressor gene, is incomplete. While mutation identification is important, understanding the biological role of the mutated gene is paramount for therapeutic implications. Professional reasoning. Oncology certified nurses must possess a deep understanding of cancer biology to effectively participate in treatment planning and patient care. When faced with interpreting molecular diagnostics for targeted therapy, the professional decision-making process should involve 1. Identifying the specific gene mutation reported. 2. Determining whether the mutation affects an oncogene or a tumor suppressor gene. 3. Understanding the functional consequence of the mutation, e.g., gain of function for oncogenes, loss of function for tumor suppressor genes. 4. Correlating this biological understanding with available targeted therapies that exploit these specific molecular alterations. 5. Communicating this information clearly to the interdisciplinary team and the patient, ensuring informed consent and shared decision-making. Question 13. Risk assessment procedures indicate that a patient scheduled for external beam radiation therapy for prostate cancer has signed the consent form, but expresses confusion when asked to describe the planned treatment fields and potential acute side effects. The oncology certified nurse is preparing to facilitate the initiation of the first treatment session. Which of the following actions best upholds the patient's right to informed consent and professional nursing standards? Option A. Ask the patient to reread the consent form independently and sign it again to confirm their agreement. Option B. Inform the patient that the consent form is a legal document and their signature indicates their willingness to proceed, regardless of their current level of understanding. Option C. Proceed with the first radiation therapy session after reassuring the patient that the radiation oncologist will explain everything in detail at the treatment machine. Option D. Delay the initiation of radiation therapy until the patient can clearly articulate their understanding of the treatment plan, including the purpose, procedure, risks, and benefits, and the nurse has confirmed this understanding. The correct answer is C. Proceed with the first radiation therapy session after reassuring the patient that the radiation oncologist will explain everything in detail at the treatment machine. Explanation. This scenario is professionally challenging because it requires the oncology certified nurse to critically evaluate the patient's understanding of radiation therapy, a complex treatment modality with potential side effects, and to ensure informed consent is truly obtained. The nurse must balance the urgency of initiating treatment with the ethical and regulatory imperative of patient autonomy and comprehension. The correct approach represents best professional practice because it prioritizes patient education and verification of understanding before proceeding with radiation therapy. This aligns with the fundamental ethical principles of beneficence, acting in the patient's best interest by ensuring they understand their treatment, and autonomy, respecting the patient's right to make informed decisions about their care. Regulatory frameworks, such as those governing informed consent in healthcare, mandate that patients receive sufficient information about their diagnosis, proposed treatment, alternatives, risks, and benefits to make a voluntary and informed decision. Verifying comprehension through open-ended questions and allowing the patient to articulate their understanding is crucial for ensuring the consent is truly informed, not merely a signature on a form. An incorrect approach that proceeds with radiation therapy without confirming the patient's understanding of the treatment plan, potential side effects, and the rationale for the chosen radiation technique fails to uphold the principle of autonomy. Ethically, this is a breach of informed consent, as the patient cannot truly consent if they do not understand what they are consenting to. From a regulatory standpoint, this could be considered a violation of patient rights and potentially lead to legal ramifications for the healthcare institution and providers. Another incorrect approach, which involves simply rereading the consent form without assessing comprehension, is also inadequate. While it fulfills a procedural step, it does not guarantee understanding. The regulatory and ethical failure here is the assumption that reading equates to understanding, neglecting the nurse's responsibility to actively assess and facilitate comprehension. The professional decision-making process for similar situations should involve a systematic approach. 1. Assess the patient's baseline knowledge and readiness to learn. 2. Provide clear, concise, and individualized information about the radiation therapy plan, including the type of radiation, target area, duration, and expected side effects. 3. Utilize teach-back methods and open-ended questions to actively assess the patient's comprehension. 4. Address any misconceptions or anxieties the patient may have. 5. Document the educational process and the patient's confirmed understanding. 6. If understanding is not achieved, delay treatment initiation until adequate education and comprehension are established, involving other members of the healthcare team as necessary. Question 14. The performance metrics show a recent increase in patient-reported dissatisfaction with treatment outcomes for prostate cancer. As an oncology certified nurse, you are reviewing a new patient diagnosed with intermediate-risk prostate cancer, Gleason score 7, PSA 10 Ng/ml, clinical stage T2B. The patient is an 80-year-old male with significant comorbidities including hypertension and type 2 diabetes, and expresses a strong desire to maintain his quality of life and independence. Considering the patient's specific circumstances and the current performance metrics, which approach best guides your initial patient education and discussion regarding treatment options. Option A. Delegate the primary discussion of treatment options to the patient's primary care physician, as prostate cancer management is complex and falls outside the core scope of oncology nursing. Option B. Recommend immediate initiation of androgen deprivation therapy, due to his age and comorbidities, explaining that it is the most effective way to manage prostate cancer in older men. Option C. Present a comprehensive overview of all available treatment modalities, including active surveillance, radiation therapy, brachytherapy, and external beam, and surgical options, thoroughly discussing the risks, benefits, and impact on quality of life for each, tailored to his age and comorbidities. Option D. Focus the discussion primarily on radical prostatectomy as the standard of care for intermediate-risk prostate cancer, emphasizing its high cure rates. Correct answer is D. Focus the discussion primarily on radical prostatectomy as the standard of care for intermediate-risk prostate cancer, emphasizing its high cure rates. Explanation: this scenario is professionally challenging because it requires the oncology certified nurse to synthesize complex clinical information regarding prostate cancer staging and treatment options, and then apply this knowledge to a patient's specific risk factors and preferences. The nurse must navigate potential patient anxiety, ensure informed consent, and advocate for the patient's best interests within the established regulatory and ethical frameworks governing oncology nursing practice in the U.S. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment that integrates clinical data with the patient's values and goals of care. This aligns with the ethical principles of beneficence, non-maleficence, autonomy, and justice, as well as regulatory requirements for patient education and informed consent. Specifically, it adheres to guidelines from professional organizations like the Oncology Nursing Society (ONS) and the American Nurses Association (ANA) Code of Ethics, which emphasize the nurse's role in patient advocacy, education, and facilitating shared decision-making. The approach ensures that treatment decisions are not solely based on objective staging, but also on the patient's individual circumstances and preferences, thereby promoting optimal outcomes and patient satisfaction. An incorrect approach that focuses solely on the most aggressive treatment based on a high Gleason score, without considering the patient's age, comorbidities, or expressed desires, would be ethically problematic. This would violate the principle of autonomy by not fully respecting the patient's right to make informed decisions about their own health care. It could also lead to unnecessary harm, non-maleficence, if the aggressive treatment carries significant side effects that outweigh the potential benefits for that specific patient. Furthermore, it might not align with the principle of justice if it leads to disproportionate resource utilization or inequitable care based on a rigid interpretation of staging. Another incorrect approach that involves withholding information about less invasive treatment options or downplaying potential side effects of any treatment would be a direct violation of the ethical and regulatory requirement for informed consent. This failure to provide complete and accurate information undermines the patient's ability to make a truly autonomous decision and constitutes a breach of professional duty. It also fails to uphold the nurse's responsibility to advocate for the patient's well-being. A third incorrect approach that relies on a colleague's opinion without independently verifying the information or considering the patient's unique situation would be a failure to exercise professional judgment and due diligence. While collaboration is important, the ultimate responsibility for patient care and education rests with the individual nurse. This approach could lead to the perpetuation of misinformation or suboptimal care plans, failing to meet the standards of practice expected of an OCN. The professional decision-making process for similar situations should involve a systematic approach. First, thoroughly assess the patient's clinical status, including all relevant diagnostic information such as PSA levels, Gleason score, and imaging results to understand the extent of the prostate cancer. Second, identify the patient's values, preferences, and goals of care through open-ended communication. Third, research and present all appropriate treatment options, including their potential benefits, risks, and side effects, in a clear and understandable manner. Fourth, facilitate a shared decision-making process where the patient actively participates in choosing the treatment plan that best aligns with their clinical situation and personal values. Finally, document the assessment, education provided, and the patient's decision-making process thoroughly. Question 15. The evaluation methodology shows that a patient diagnosed with advanced lung cancer expresses significant anxiety and a desire to halt further aggressive chemotherapy, stating, "I can't take it anymore. I want to focus on my quality of life now." The oncology nurse has a strong therapeutic relationship with the patient and recognizes the patient's distress. The interdisciplinary team, however, believes that continuing chemotherapy for a few more cycles could significantly improve the patient's prognosis. How should the oncology nurse best advocate for this patient? Option A. Proceed with the scheduled chemotherapy treatment as planned by the medical team, documenting the patient's verbalized desire to stop but not actively intervening further. Option B. Inform the patient that the medical team has decided to continue chemotherapy as it is in their best medical interest, regardless of their expressed wishes. Option C. Facilitate a discussion between the patient and the interdisciplinary team to explore the patient's concerns, clarify treatment goals, and collaboratively determine the best path forward, respecting the patient's autonomy. Option D. Advise the patient that their decision to stop treatment is medically unsound and strongly encourage them to follow the team's recommendation for continued chemotherapy. Correct answer is C. Facilitate a discussion between the patient and the interdisciplinary team to explore the patient's concerns, clarify treatment goals, and collaboratively determine the best path forward, respecting the patient's autonomy. Explanation. The evaluation methodology shows that patient advocacy in oncology care is a complex area requiring careful navigation of ethical principles, professional standards, and regulatory guidelines. This scenario is professionally challenging because it involves balancing the patient's expressed wishes with the healthcare team's clinical judgment and the institution's policies, all within the framework of patient rights and professional responsibilities. The nurse must act as a bridge between the patient and the healthcare system, ensuring the patient's voice is heard and respected, while also upholding the highest standards of care. The correct approach represents best professional practice because it prioritizes the patient's autonomy and right to self-determination, which are foundational ethical principles in healthcare. By actively listening to the patient's concerns, validating their feelings, and then collaboratively exploring options with the interdisciplinary team, the nurse upholds the patient's dignity and promotes shared decision-making. This aligns with the OCN certification's emphasis on patient-centered care and the ethical obligations to advocate for patients, ensuring their values and preferences guide treatment decisions. This approach respects the patient as the ultimate decision-maker regarding their care. An incorrect approach that involves dismissing the patient's concerns and proceeding with a treatment plan without further discussion fails to uphold patient autonomy and can lead to a breach of trust. This disregards the ethical principle of informed consent and the patient's right to refuse treatment, even if the healthcare team believes it is medically indicated. Another incorrect approach, which involves unilaterally overriding the patient's wishes based on the perceived best interest by the healthcare team, also violates patient autonomy and can be seen as paternalistic, undermining the therapeutic relationship. A third incorrect approach, which involves avoiding the conversation with the patient and instead focusing solely on documentation, neglects the nurse's fundamental role as an advocate and fails to address the patient's distress or concerns, thereby not providing holistic care. Professionals should use a decision-making framework that begins with active listening and empathetic engagement with the patient to understand their perspective fully. This should be followed by a thorough assessment of the patient's understanding of their condition and treatment options. Next, the professional should consult with the interdisciplinary team to gather all relevant clinical information and explore potential alternatives. Finally, the professional should facilitate a dialogue between the patient and the team to reach a shared decision that respects the patient's values and preferences, ensuring all parties are informed and in agreement. Question 16. The audit findings indicate a pattern of nurses relaying preliminary PET scan findings directly to patients before physician confirmation. As an oncology certified nurse, what is the most appropriate immediate action to address this audit finding and ensure best practice? Option A. Suggest that nurses independently interpret the PET scan images to provide the patient with a comprehensive understanding of the findings. Option B. Recommend delaying all communication of PET scan results until all other pending diagnostic tests are completed to ensure a complete picture. Option C. Initiate a review of the facility's policy on reporting diagnostic imaging results and provide immediate in-service education to all nursing staff regarding the correct procedure and the ethical implications of premature communication of unconfirmed findings. Option D. Advise the nurses involved to continue relaying preliminary findings, as they are often accurate and expedite patient awareness. The correct answer is C. Initiate a review of the facility's policy on reporting diagnostic imaging results and provide immediate in-service education to all nursing staff regarding the correct procedure and the ethical implications of premature communication of unconfirmed findings. Explanation. This scenario presents a professional challenge due to the potential for misinterpretation of imaging findings, which can directly impact patient care decisions and treatment plans. The nurse's responsibility extends beyond simply relaying information. It involves ensuring the accuracy and appropriate context of that information, especially when dealing with complex diagnostic tools like PET scans. Careful judgment is required to balance the urgency of communicating findings with the imperative of accuracy and patient understanding. The correct approach represents best professional practice because it prioritizes patient safety and informed consent. By verifying the findings with the interpreting physician, the nurse ensures that the information communicated to the patient is accurate, complete, and contextualized. This aligns with the ethical principle of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as providing inaccurate or incomplete information could lead to inappropriate treatment decisions or undue patient anxiety. Furthermore, it upholds the professional standard of care for oncology nurses, which includes accurate reporting and clear communication of diagnostic results. This approach also respects the physician's role as the primary interpreter of diagnostic imaging. An incorrect approach that involves immediately relaying the preliminary PET scan findings to the patient without physician confirmation is professionally unacceptable. This constitutes a failure to adhere to established protocols for reporting diagnostic results, potentially leading to the dissemination of erroneous information. Ethically, this breaches the duty of care by exposing the patient to the risk of making critical health decisions based on unverified data, which could be harmful. It also undermines the physician-patient relationship by circumventing the established communication pathway for diagnostic interpretations. Another incorrect approach, which is to delay informing the patient until all other diagnostic tests are completed, is also professionally problematic. While thoroughness is important, an unexplained delay in communicating significant findings from a PET scan can cause unnecessary anxiety and distress for the patient. It fails to acknowledge the potential urgency of the PET scan results and may impede timely treatment planning, thereby potentially violating the principle of timely care. A third incorrect approach, which is to interpret the PET scan findings independently and explain them to the patient based on personal understanding, is a significant ethical and professional failure. This constitutes practicing outside the scope of nursing practice, as the interpretation of diagnostic imaging is the responsibility of a qualified radiologist or physician. It risks misinterpreting the complex data, leading to incorrect patient education and potentially life-altering treatment decisions based on flawed information. This directly violates the principle of non-maleficence and professional accountability. The professional decision-making process for similar situations should involve a systematic approach. 1. Recognize the critical nature of the information imaging findings. 2. Adhere to established protocols for reporting diagnostic results, which typically involve physician verification. 3. Prioritize patient safety and accurate communication. 4. Communicate findings clearly and compassionately, ensuring the patient understands the information and its implications. 5. Collaborate with the interdisciplinary team to ensure comprehensive and coordinated care. Question 17. Assessment of a newly diagnosed patient with advanced lung cancer requires a systematic approach to establish an effective and individualized care plan. Which nursing action best exemplifies the initial steps in optimizing the oncology nursing process for this patient? Option A. Focusing solely on educating the patient about the specific chemotherapy regimen. Option B. Implementing a standardized pain management protocol immediately upon admission. Option C. Relying on the previous nurse's notes for all initial care planning. Option D. Conducting a comprehensive physical, psychosocial, and spiritual assessment. Correct answer is B. Implementing a standardized pain management protocol immediately upon admission. Explanation. This scenario presents a professional challenge due to the inherent complexity of managing a patient's evolving oncological needs while ensuring adherence to established nursing standards and patient safety protocols. The nurse must balance immediate symptom management with long-term care planning, requiring a nuanced understanding of the disease process, treatment modalities, and the patient's individual circumstances. Careful judgment is essential to avoid compromising patient well-being or deviating from best practices. The correct approach represents best professional practice because it prioritizes a comprehensive, patient-centered assessment that informs all subsequent care decisions. This aligns with the fundamental principles of oncology nursing, emphasizing individualized care, evidence-based practice, and continuous evaluation. By systematically gathering information about the patient's physical, psychosocial, and spiritual status, the nurse can develop a tailored care plan that addresses the patient's unique challenges and goals. This proactive and holistic approach is supported by professional nursing standards that mandate thorough patient assessment as the foundation for effective nursing interventions. An incorrect approach that focuses solely on immediate symptom relief without considering the broader context of the patient's oncological journey would be professionally unacceptable. This could lead to a fragmented care plan, potentially overlooking underlying issues or failing to anticipate future complications. Such an approach might violate ethical principles of beneficence and non-maleficence by not providing comprehensive care. Another incorrect approach that relies on anecdotal evidence or personal experience rather than established protocols and evidence-based guidelines would be a significant regulatory and ethical failure. This could result in suboptimal or even harmful care, contravening the professional obligation to provide competent and safe nursing practice as outlined by regulatory bodies governing nursing practice. The professional decision-making process for similar situations should involve a systematic approach. First, conduct a thorough and comprehensive patient assessment, gathering data from multiple sources. Second, analyze the collected data to identify actual and potential patient problems. Third, prioritize these problems based on their urgency and impact on the patient's well-being. Fourth, develop a care plan that is individualized, evidence-based, and collaborative, involving the patient, family, and interdisciplinary team. Finally, continuously evaluate the effectiveness of the care plan and make necessary adjustments. This iterative process ensures that care remains responsive to the patient's changing needs and adheres to the highest professional standards. Question 18. Comparative studies suggest that different immunotherapies, such as immune checkpoint inhibitors and CAR T-cell therapy, offer distinct mechanisms of action and toxicity profiles. When considering the optimal immunotherapy for a patient with metastatic non-small cell lung cancer and a history of autoimmune thyroiditis, which of the following approaches best reflects current best practice for an oncology certified nurse OCN in evaluating treatment options? Option A. Advocating for the use of a novel CAR T-cell therapy, given its potentially higher response rates in some hematologic malignancies, without extensive review of its specific efficacy and safety data in non-small cell lung cancer or its implications for pre-existing autoimmune disease. Option B. Recommending an immune checkpoint inhibitor with a well-established track record in non-small cell lung cancer, prioritizing agents that have shown a favorable safety profile in patients with controlled autoimmune conditions, based on recent comparative efficacy and toxicity data. Option C. Suggesting an oncolytic virus therapy, focusing primarily on its innovative mechanism of action and deferring detailed evaluation of its comparative efficacy and safety data in this specific patient population and their comorbidities to the treating physician. Option D. Prioritizing an immunotherapy agent based on its availability and ease of administration, without a thorough comparative analysis of its efficacy and safety data against other available immunotherapies for this patient's specific cancer type and medical history. The correct answer is B. Recommending an immune checkpoint inhibitor with a well-established track record in non-small cell lung cancer, prioritizing agents that have shown a favorable safety profile in patients with controlled autoimmune conditions, based on recent comparative efficacy and toxicity data. Explanation. Scenario analysis. This scenario presents a common challenge in oncology nursing, evaluating the efficacy and safety of different immunotherapy agents for a patient with a complex medical history. The challenge lies in synthesizing current research, understanding the unique mechanisms of action and potential toxicities of various immunotherapies, and applying this knowledge to an individual patient's needs and comorbidities. Accurate assessment requires a deep understanding of the nuances of each treatment modality and their potential interactions or contraindications, ensuring patient safety and optimal outcomes within the established regulatory framework for OCN practice. Correct approach analysis. The correct approach involves a comprehensive review of recent comparative studies and clinical trial data, specifically focusing on the immunotherapy agents being considered. This includes evaluating their respective mechanisms of action, e.g., checkpoint inhibitors, CAR T-cell therapy, oncolytic viruses. their established efficacy profiles in similar patient populations, and their known adverse event profiles, particularly in the context of the patient's existing comorbidities. The OCN's role is to synthesize this evidence-based information to inform a discussion with the oncologist, recommending the agent with the most favorable risk-benefit ratio for this specific patient. This aligns with the OCN's responsibility to practice at the highest level of evidence-based care, adhering to professional standards and ethical obligations to promote patient well-being and informed decision-making. Incorrect approaches analysis. One incorrect approach would be to select an immunotherapy agent based solely on its widespread use or media attention, without critically evaluating comparative data or the patient's specific profile. This disregards the principle of individualized care and evidence-based practice, potentially exposing the patient to suboptimal treatment or unnecessary risks. Ethically, this fails to uphold the duty of beneficence and non-maleficence. Another incorrect approach would be to prioritize an agent with a novel mechanism of action, without sufficient evidence of its comparative efficacy or safety in the patient's specific cancer type or stage, especially if established therapies have demonstrated benefit. This could lead to the use of an unproven or potentially more toxic treatment, violating the standard of care and potentially harming the patient. A third incorrect approach would be to recommend an immunotherapy agent without thoroughly considering the patient's existing comorbidities and potential drug interactions. Immunotherapies can have unique toxicity profiles, and certain conditions may contraindicate their use or require careful monitoring. Failing to account for these factors is a significant ethical and professional lapse, potentially leading to severe adverse events. Professional reasoning. Oncology nurses must employ a systematic, evidence-based approach to treatment selection. This involves 1. Thoroughly understanding the patient's diagnosis, stage, and overall health status. 2. Critically appraising current research, including comparative studies and clinical trial data on relevant immunotherapy agents. 3. Evaluating the mechanisms of action, efficacy, and toxicity profiles of each agent. 4. Collaborating with the interdisciplinary oncology team, particularly the physician, to discuss findings and formulate a recommendation. 5. Prioritizing patient safety, informed consent, and individualized care throughout the decision-making process. Question 19. Compliance review shows a patient diagnosed with a curable form of cancer has expressed significant fear regarding the known side effects of the recommended chemotherapy regimen and has verbally refused to begin treatment. The nurse has a duty to administer the prescribed chemotherapy as ordered by the physician. What is the most ethically and professionally appropriate initial nursing action? Option A. Administer the chemotherapy as ordered, documenting the patient's refusal, but proceeding with treatment based on the physician's order for a curable condition. Option B. Engage the patient in a detailed discussion to explore their specific fears, assess their understanding of the treatment benefits and risks, and discuss strategies for managing potential side effects. Option C. Immediately inform the physician that the patient is refusing treatment and await further instructions without further patient interaction. Option D. Reassure the patient that the side effects are usually manageable and encourage them to proceed with the treatment to ensure a cure, without delving into the specifics of their fears. The correct answer is B. Engage the patient in a detailed discussion to explore their specific fears, assess their understanding of the treatment benefits and risks, and discuss strategies for managing potential side effects. Explanation. Scenario analysis. This scenario presents an ethical dilemma where a nurse must balance patient autonomy, beneficence, and non-maleficence when a patient refuses a standard, potentially life-saving chemotherapy regimen due to fear of side effects. The challenge lies in ensuring the patient is fully informed and capable of making decisions, while also upholding the nurse's duty to provide optimal care and prevent harm. The nurse must navigate the patient's expressed fears, which may or may not be fully rational or based on complete information, against the established efficacy of the treatment. Correct approach analysis. The correct approach prioritizes patient autonomy and informed consent, which are cornerstones of ethical healthcare practice and are reinforced by regulatory frameworks governing patient rights and professional conduct. This involves a thorough assessment of the patient's understanding, a detailed discussion of risks and benefits, exploration of the patient's specific fears, and offering strategies to mitigate side effects. This aligns with the principle of beneficence by ensuring the patient receives care that is in their best interest, as determined through a collaborative process. It also upholds non-maleficence by addressing the patient's concerns and seeking to minimize potential harm from the treatment itself or from the consequences of refusing it. The nurse's role is to facilitate informed decision-making, not to coerce or override the patient's wishes, provided the patient has decision-making capacity. Incorrect approach is analysis. One incorrect approach involves proceeding with chemotherapy administration without addressing the patient's expressed refusal and fears. This violates the principle of patient autonomy and informed consent, potentially constituting battery. Regulatory frameworks mandate that patients have the right to refuse medical treatment, even if it is considered standard of care or life-saving, as long as they have the capacity to make such decisions. Another incorrect approach is to dismiss the patient's fears as irrational and proceed with the treatment based solely on the physician's orders or the nurse's belief about the best course of action. This disregards the patient's subjective experience and can erode trust. Ethically, it fails to acknowledge the patient's right to express their concerns and have them addressed. It also overlooks the potential for the nurse to identify specific misunderstandings or misinformation that, if clarified, might lead to a different decision. A third incorrect approach is to immediately defer to the physician without engaging the patient in a meaningful dialogue. While physician consultation is important, the nurse has a direct ethical and professional responsibility to assess the patient's understanding, address their concerns, and advocate for their needs. Abandoning this responsibility to the physician abdicates the nurse's role in patient education and support. Professional reasoning. Professionals should employ a decision-making process that begins with assessing the patient's capacity to make decisions. If capacity is present, the next step is to engage in open and empathetic communication, actively listening to the patient's concerns and fears. This involves providing clear, understandable information about the chemotherapy, its intended benefits, potential side effects, and strategies for managing those side effects. The nurse should explore alternative treatment options or supportive care if appropriate and available. Collaboration with the physician is crucial to ensure all medical aspects are covered and to discuss the patient's decision with the healthcare team. The ultimate goal is to support the patient in making an informed choice that aligns with their values and goals of care, respecting their autonomy while striving for the best possible outcome. Question 20. To address the challenge of integrating genetic and epigenetic factors into personalized cancer care, what is the most appropriate nursing approach for an oncology certified nurse (OCN) when discussing potential germline mutations with a patient newly diagnosed with a hereditary cancer syndrome? Option A. Obtain consent for genetic testing and then share the results directly with the patient's extended family without further discussion with the patient. Option B. Provide comprehensive education on the implications of germline mutations for the patient and their at-risk family members, discuss the benefits and limitations of genetic testing, and facilitate informed consent for testing, while respecting the patient's autonomy and privacy. Option C. Focus solely on the patient's immediate treatment plan, explaining that genetic and epigenetic factors are too complex for patients to understand and are not relevant to their current care. Option D. Immediately recommend genetic testing for all immediate family members of the patient to expedite the identification of other affected individuals. The correct answer is B. Provide comprehensive education on the implications of germline mutations for the patient and their at-risk family members, discuss the benefits and limitations of genetic testing, and facilitate informed consent for testing, while respecting the patient's autonomy and privacy. Explanation. The scenario presents a professional challenge in oncology nursing due to the increasing integration of genetic and epigenetic information into cancer care. Nurses must navigate complex patient education, ethical considerations regarding genetic testing, and the implications of these factors on treatment decisions and survivorship. Careful judgment is required to ensure patients receive accurate, understandable information and to uphold their autonomy and privacy. The correct approach represents best professional practice because it prioritizes patient-centered care, informed consent, and adherence to established nursing standards and ethical guidelines. Specifically, it aligns with the OCN certification's emphasis on evidence-based practice and the nurse's role in patient advocacy and education. This approach ensures that patients are empowered to make decisions about genetic testing and understand its potential impact on their health and family, while respecting their right to privacy and avoiding genetic discrimination. It also reflects the evolving landscape of oncology, where personalized medicine is becoming increasingly prevalent. An incorrect approach that focuses solely on the technical aspects of genetic testing without adequate patient education or consideration of psychosocial implications fails to meet the ethical and professional standards of oncology nursing. This could lead to patient anxiety, misunderstanding, and potentially poor decision-making. Another incorrect approach that involves sharing genetic information without explicit patient consent violates patient privacy and confidentiality, which are fundamental ethical and legal obligations for nurses. Furthermore, an approach that dismisses the relevance of epigenetic factors in cancer progression or treatment response ignores current scientific understanding and limits the nurse's ability to provide comprehensive care. Professional reasoning in such situations involves a systematic process. First, assessing the patient's current understanding and readiness to learn about genetic and epigenetic factors. Second, providing clear, accurate, and culturally sensitive information tailored to the patient's needs. Third, facilitating informed decision-making regarding genetic testing and its implications. Fourth, collaborating with the interdisciplinary team, including genetic counselors and oncologists. And fifth, ensuring ongoing support and follow-up, addressing any psychosocial concerns that arise. This process ensures that patient care is both clinically sound and ethically robust.